Welcome back to our Busting Addiction and Its Myths podcast. I'm Bruno J., and I have updated the introduction to our episodes in order to address an issue that we cannot ignore, nor do we want to. It looks like COVID-19, the coronavirus, will be with us for some time. Some say for another year or two. People are as frightened as they ever have been. They seek safety for their families above all, protection from the virus and from economic insecurity. But many families also face an added burden, drug addiction and alcoholism in their own homes, and what to do about it. There's something you should know. We, SafeHouse Rehab Thailand, were founded on the idea of safety. We hold on to the truth that clients deserve to come to a treatment clinic where they can at least feel safe and sound. Devoting ourselves to safety first gives us the firm foundation upon which everything else is constructed, hence our name, SafeHouse Rehab Thailand. Thailand has been recognized as one of the world's safest places to be during the pandemic. Further, we at SafeHouse have made the right adjustments so that clients and staff remain and feel safe and sound. Masks are mandatory, as is social distancing, mandatory hand cleaning, daily blood oximeter readings, which is an early warning measure, and if by chance anyone doesn't feel well, the local hospital in Bang Bung is only minutes away. My podcast, Busting Addiction and Its Myths, is dedicated to serving families of still suffering addicts and alcoholics by providing evidence-based advice and insight so that you can make a better informed decision on what to do and what not to do. We are sponsored by SafeHouse Rehab Thailand, dedicated to a modern approach to recovery, which means that we absolutely outperform traditional rehabs when it comes to diagnostics, technology, and aftercare. To learn how we can help, just visit safehouserehab.com, where we post the latest news. Hello, I'm Bruno J., and welcome back to Busting Addiction and Its Myths, and if you're a first-time listener, welcome aboard. This marks episode 12 of Season 5, which makes it 64 total episodes, once every week without a break. And that's because addiction and alcoholism are such wide and deep topics that there's always some new insight to bring to our audience. We're also a bit proud of being named as one of the top 100 podcasts in our category by FeedSpot, a respected third party. So we must be doing something right, bringing what we believe is a valuable perspective on the challenges of addictive disorder. Not only is there much already published by authors and experts in our field, government agencies such as the NIH, pharmaceutical companies, and not-for-profits continue to aggressively pursue research in the addiction space. Interest in big-scale solutions has accelerated in the last 5 years as the opioid epidemic continues to ravage North America and other countries, with as many as 100 overdose deaths recorded every day in the U.S. alone. The availability of Naxalone, also known as Narcan, is used to counter the effects of opioid overdoses, and it has helped stem the tide, enabling first responders to battle the effects of heroin and fentanyl on our streets. They often watch astounded as the near miraculous effects of Narcan awaken an addict from what appears to be certain death. That small, albeit important contribution to the solution is really not nearly enough. All agree that what's needed is a big picture view of how the entire healthcare system should tackle addiction and alcoholism from the very beginning, all the way through to performance monitoring and continuous improvement. Why do I even bring this up when you as a parent or loved one of the suffering addict really just want to know, what do I do now? Fact is, you can do something. You can help put a stop to ineffective approaches to addiction treatment, which have for years contributed to the acceleration of the incidence of addiction. Even though you might have limited options when it comes to changing the downward trajectory of your loved one's path of addiction, you can make a difference by supporting organizations whose purpose is to improve outcomes for those who suffer from addictive disorder. One such not-for-profit who stands on the front lines is called Shatterproof.org. And I should quickly point out that we at SafeHouse Rehab have no financial or other type of interest in the organization. I bring Shatterproof to your attention because it stands out as among the very best at changing how we as a society care for those who suffer from addictive disorder. Just visit shatterproof.org to learn how you can help, whether it's by donation or by supporting national, state level, or local initiatives to improve outcomes. I'm a plain-spoken guy. One of my heroes is Harry Truman, who had a sign on his desk in the Oval Office of the President of the United States which read, "The buck stops here." In other words, you can pass the buck all you want, avoid responsibility all you want, but at some point the buck has to stop and someone has to be held accountable for the things over which we do have some influence. The addiction crisis, especially the opioid crisis, along with the rapid rise of methamphetamines and illegal synthetics, is a collective problem that must be addressed by us all. That's where you can add your voice and your energy in ways that will help improve outcomes for those who suffer from this disorder. Now, what does it mean to improve outcomes? Well, in plain language, it looks like this. When a family doctor is trained to spot symptoms of addiction, that is an improved outcome on the early intervention front. When all medical schools conduct intensive education on the symptoms and treatment of addictive disease, and currently only half of all medical schools have any level of training on that topic, that's an improved outcome. When all psychologists, that is, non-MDs, are alert to the possibilities of addictive disorder and refer patients to those trained to treat them, such as specialist MDs and counselors, that will improve outcomes. When stakeholders, families, the medical community, educators, legislators adopt disease management beyond the fix of a 28-day program, then outcomes will surely improve. This is what I wish to underline to any family member who cares for and loves an addict or alcoholic. This is your chance to make a difference for those who suffer from the effects of addiction, including families and loved ones. Keep in mind that for every addict or alcoholic, there are 6 other innocent people affected. These efforts point to a future that promises earlier detection, more effective treatment, lower incidence of addiction, and less pain for our society. Further, by educating yourself on what is possible, specific to your or your loved one's disorder, you can have a more immediate impact on the course of treatment or other types of interventions. You will be doing something to help others, to give to something greater than yourself, and you will find that you're not alone. You will feel joyfully useful in the company of those who share the same mission. You will feel a change for the better, knowing you're doing a good thing for others. Shatterproof supports evidence-based practices which improve outcomes for individuals with a substance abuse disorder. So we join Shatterproof in advocating the following. 1. Routine screenings for substance abuse disorder in every medical setting, as routine as getting your blood pressure taken. If there is evidence of abuse, referral to an addiction specialist and/or a follow-up plan is recommended. At SafeHouse Rehab, we make sure that we conduct a thorough and precise assessment of all medical issues attendant to each individual who comes to us for treatment of substance abuse disorder. 2. A personal plan for every patient. Treatment facilities, no matter who or where or how well known, simply must create personalized treatment plans nuanced to each individual's needs. At SafeHouse Rehab, we make sure we understand and take all medical factors into account as part of the intake process, all medical and lifestyle factors. Only then are we in a position to build a treatment plan that meets the needs of each client, one client at a time. 3. Fast access to treatment. This is an obstacle for many addicts and alcoholics who are stuck in a holding pattern in their home countries, awaiting space in an inpatient or even an outpatient program. Those who want it should be able to get treatment as soon as they're ready. Consider supporting initiatives that make this more possible in your community. 4. Long-term disease management. Addiction, sadly, is a lifetime disorder. Many have difficulty believing the truth of it. The fact is that treatment is just the beginning of long-term disease management, including the addict's owning his own recovery program. Disease management must also include coordinated care for every illness. Example, ideally by staying in the same healthcare system, clinicians have access to the full medical history of patients and can work together more effectively as a team on behalf of the patient. At SafeHouse Rehab, we've developed an aftercare approach called WeCare, which consists of a full suite of tools and follow-up care that guides our clients toward a lifetime of clean and sober living outside of the clinical setting. 5. Insisting on best practice therapies is important. Treatment facilities must be licensed by the appropriate authorities, and their professionals must have degrees in specific disciplines that deal with addictive disorder. Proven therapies include cognitive behavioral therapy, individual supportive psychotherapy, families and couples therapy, and motivational enhancement therapy. We are proficient at all of the therapies above, but we also include an introduction to the 12-step programs of Alcoholics Anonymous, that is AA, and Narcotics Anonymous, which is NA. We firmly believe that our clients need to own their own recovery and the support of other recovering people to embark on their lifetime journey. So what have we learned about family members' role in the larger scope of addictive disorder? We asked them to consider the following. Families can have an impact on the larger picture of improving outcomes by supporting initiatives such as the ones proposed by Shatterproof. 2. In so doing, family members and loved ones will have the satisfaction of knowing that they are not powerless to be of help to society. They can help put a stop to ineffective, marginal solutions to a central problem, a problem that is bigger than themselves. 3. By practicing the modern approach to recovery, SafeHouse Rehab meets or exceeds all best practices for treatment, consistent with those outlined by Shatterproof. 4. We are proud to support the efforts of organizations whose mission is to improve outcomes for those with substance abuse disorder. 5. Working with others to support positive change will rejuvenate the spirit of family members who know they're doing something to help a cause that is greater than themselves. Thank you for tuning in today. This podcast is sponsored by SafeHouseRehab.com. SafeHouse Rehab represents the modern approach to recovery founded on safety as our first priority. We absolutely outperform traditional rehabs with a sophisticated intake protocol, application of new techniques, and a more robust aftercare program.